To be for the next 50 minutes, exactly, moderated by Angelo. We're actually going to be talking through equality data, policy implications, and translation. So bear in mind, everybody, we have participants who love to talk. So give me enough time in order, and online and in the room, get your questions ready so that we can dash around as we're able to. Yeah, over to you, Angelo.
Does this work? Yeah. Before we start our interactive session, I was told to give the stage to Sven for a second. Yes. In correlation to the session before, because Sven has some interesting insights to share before we start.
Okay. Thank you. Are the people with the computers ready to show something on the screen? Yeah, you can go to the EU Health Policy Platform. I'm very much what that is. Yeah, so I'm representing the aviation healthcare industry. All the pilots have to do a full body and brain scan every month, every semester, every year to reactivate their flying license, because of course you don't want that your pilot gets a brain infarctus or a heart infarctus at 10,000 meters altitude, do you? That makes that we have, of course, a huge database of health data. And yeah, for us pilots, the world is our village. Borders are very relative to us, so we use also the UN Silk Roads program a lot, reminding us that our ancestors have been sharing meals together for over 4,000 years, exchanging goods, bringing prosperity thanks to that, and also peace. And we also use the UN decade for people of African descent, and you know that 2024 is a jubileum year because it's the end of this decade. We also have a lot of artworks on the UN decade, so if there are people here organizing festivals or some festivities, you can always come to us. We have a lot of artworks. So what happened is that you have the 2019 pandemic. You know, Europe is all about free movement of people, services, goods, and so forth. That is until that person, that citizen, is a patient. Then you have to stay in your own country for treatment. Fortunately, since the COVID pandemic, you may know that Ms. von der Leyen, she's a medical doctor, and on top of that, she has a PhD in epidemiology. And those epidemiologists, they need, of course, a lot of access to a lot of data to see a little wrinkle appearing, something that might indicate, and then call up all these people and eventually offer them to screen their whole genome, for example, to see if there is something that these people share genetically. Since 2022, more or less, the Director General of Health, with Ms. Kyriakides, who is herself a psychologist and a cancer survivor, they created this safe space where we can all enter. So everybody who has some interest in health can register here, and then you can meet us. There are now more than 6,800 people representing some regional, national, or European federation. Can be from the pharma industry, can be from the medical doctors, but can also be patient organizations. And so we are bringing in all the knowledge from the airplane health industry. I think, yeah, and we are also, you can also maybe write down the Europa, the 1 million, this one up quickly. The genome project. On the health policy platform? No, just a new Google search. Okay. 1 million genome project. Yeah. This one? Yeah, that's the one. I think. No, that's from the no. So we have one like this, but for if you type Europa in front of it, Europa, 1 million genome flagship initiative, that one. And so here as well. So if there are people who are really trying to find if there is race related stuff in your genes, if you hope to find it, then it would be possible to find it here. So we have all the genomes of our pilots, for example, that we are going to put available here, according, of course, taking into account all the fair FAIR guidelines from the new Director General of Health. I think that's about it. Thank you.
Thank you.
Thank you, Angelo,
Just
for
checking
your
out some-
flexibility.
Yes.
Thank you for the short presentation. Thank you for having us. So yeah, we're gonna have short interactive sessions. No worries, it's not another dance session. Interactive in the sense of we want to make sure that the conversation that we're having in front here isn't a conversation that can be extended into the room. So feel free to chime in, raise your hands, make some points on the things that we address. This session specifically focused on kind of bringing together what we've talked about yesterday and today with respect to policy action. So the idea is that we just explore the lessons that we can take specifically from, for example, the case of the Dutch case or the German case, but also the Florath report with respect to what is needed for policy implications and actions. Okay. Before I hand over to the two people that join me and let them introduce themselves, I'm just briefly going to introduce myself, and then also I'm supposed to talk a little bit about each one, teach one again. So my name is Angelo Camufingo. I live and work in Berlin. I am one of the project leads at Each One Teach One, the organization that Muna just presented with respect to the Afro-census. The project that I'm co-leading with Magda Isaac is called the Competence Network for People of African Descent or Against Anti-Black Racism, which is one of the projects that she mentioned. Each One Teach One has a long history. We have a 10-year anniversary in terms of funding this year. And the Compet specifically is the biggest project of that organization. So Each One Teach One mostly has a focus on empowering Black people and doing a lot for the community, maybe through the youth project or the community project. But the Compet project is a federal project that Each One Teach One is a part of with the initiative of Black people in Germany. And their specific approach is to have a focus on consulting, but also educating the general public on issues of Black people, people of African descent in the country. So what we do is we have certain measures that we take in each project year to think about what can we do to inform certain bodies, to inform certain institutions, people, stakeholders with respect to the situation of people of African descent. So the translation of the Afro-census, which happened last year into English, which is going to be released in July, is basically one of the things that we put into place simply because we realized we want to take this opportunity to kind of bring other people into the conversation. We know that there has been a large interest, but just not really access to it because of language. But then also a lot of people think that we did an English translation just for transnational connections. We also did an English translation because we want to reach people in the country that just have easier access to all this information in a different language, right? So to also make sure that we have a multilingual audience in the country itself that can access this information and then potentially see what to do with it and take certain things out of that particular study. The importance of the study and the importance of the translation specifically lies also in the fact that we realized that in terms of equality data or equity data collection in Germany, that is a big topic. Muna has already touched upon the German history in relation to why it is so difficult. But I think sometimes that is still not necessarily well understood because, for example, if you would look at the European Anti-Racism Action Plan map that ENO has released, for example, where they looked at specific countries and how their approaches to action plans, you can also see a chapter on Germany, which quite specifically picks up all the points that Germany is involved in with respect to the action plans and anti-racism. But what it doesn't put like shed light on is basically how these things might look cute to the outside and they present a commitment, but they don't necessarily present how things are actually working or how difficult it is to put things into place. So for example, if you use the project that I'm working for, that I'm leading, it's a project that also had the task to monitor, but there's so many high bureaucracy demands and all of the other things that we are being put through that it's quite hard to actually do the things that Germany and other spots says that they're doing. So as much as Germany is portraying things that they're a part of and that they're trying to advocate for, there is a lack of like who is then responsible to actually put these things into place and how many resources do they have with respect to money, staff, but also just like how many, for example, reports do I have to write and how much time does that take away from the actual work that I'm supposed to do with respect to data collection, right? So that is one example why, for example, this transnational connection is so important to see like what can we learn from each other, what can we take away, but then also who is it actually that we need to kind of bring into these conversations and hold responsible to like make sure that there's either more specific recommendations on how to do certain things and how like certain structures in countries are, but also just like what else can be done in order to like fund or to like support these national efforts. And that leads me to my two guests and also soon to the first question. So before I pose the question, please, would you introduce yourselves?
Yes, hello, it's my pleasure to be here. My name is Tanja Florath. I work for the European Commission, DG Just, and more specifically for the anti-racism coordinator, Michaela Moore. You met my colleague Vanessa yesterday. I would like to emphasize from a policy-making point of view the need for data that we have in order to actually implement the anti-racism action plan, but we will go into detail in a minute. I'm also, maybe for the background, I'm a national seconded from the German federal government, and for the last 2 days I was very happy that I don't have to answer questions for the German government, that I work for the EU at the moment.
Hi everyone, my name is Daris. I work for Equinet, as I already introduced before. I work as a legal and policy officer, particularly I coordinate the working group on research and data collection. And also I work on racial discrimination and related intolerances. I not only for my work, but I also have, of course, a personal interest in the link between racial discrimination and equality data, and these 2 days have been very interesting for me as well. And I hope that we have an interesting session as well today.
Thank you. And just as a reminder, like I said, feel free to also pose specific questions in between, give statements if you have more knowledge than we do in certain areas like statistics, for my case, for example. But also to you guys, if you have questions to each other, also feel free to just engage, okay? So to the first question, which is probably already quite specific to the description that you also read in the plan, trying to take a step towards concrete solutions and recommendations and requirements, I would like to ask you to, what do you see as some of the challenges and opportunities of data collection, such as the FRA report or the Dutch and the German cases, with respect to policy implications, and then obviously with respect to the areas, how that relates to that?
Okay, as I said, from the perspective of a policy maker and not a decision maker, but a policy maker, there's a slight difference, not that you confuse the two. When I started last year, one of the first things I had to do was to organize a workshop on health and racism. And I thought, for the introductory speech, I'm just going to Google a couple of numbers and show how many Europeans have a heart attack in the last couple of years and how many of them were of African descent. So as you can imagine, that didn't work out well. So I was going deeper into the research, and at a certain point I figured out that we don't even know how many people of African descent live in Europe, because we don't have this kind of data. So, so you can imagine that fighting anti-Black racism is a very difficult task per se, but not even having any kind of numbers, not even a baseline, it makes it kind of impossible. I know the discussions that we have in Germany where we like to use proxies like the language spoken at home, but mostly the place of birth or the place of birth of your parents, or no, the place of birth of other family members, which go further back. We have a certain percentage of Europeans that are just not visible. They basically in statistics do not exist. Which also means that we don't have a baseline and we don't have indicators and we can't say anything about their life experiences. And in this particular regard, I must say for myself that it's not even about the racist discrimination that they experience, but their general life experience. So I can give a speech on what 14 to 16-year-olds, male Europeans, did during COVID on the afternoons and how much time they spent on their laptops. But I can't say how many Black people live in Europe. That's a bit insane, to be honest. So that's one of the things that we trying to convince states to actually think about and address. And one of the things that you will find is that they use data protection as one of the arguments of not doing that. But the European data protection law doesn't exclude the collection of data of the specific equality data. It actually just says, gives a framework of how to do it and what kind of protection and safeguards you need. It doesn't say you can't do it, but it's often interpreted as a we can't do it. The other point that I would like to make is that you look at the EU statistics, you go on the EU population portal, we have a demographic portal, and it has a subcategory called diversity. And diversity is citizenship, migration, and age. And that's it. More categories we do not have in regard to diversity of the European population. Also, from the point of the policy maker, the Anti-Racism Action Plan says the new EU health program and Europe's Beating Cancer Plan will address health inequalities by taking into account the specific needs of different groups. That's in the EU Anti-Racism Action Plan. So what does that mean? And how do we measure that? Is this some kind of formulation where in the end I can say, well, we did because we had the program and the program automatically addresses all kinds of vulnerable groups? Or is it something where I can actually say, these are the groups I'm talking about, and this is what changed for them based on this program? So, and this is why we need this kind of data. This is why I'm a huge fan of the Afrocensus, because it gives an insight into life experience of a significant portion of the European population. Well, the German population. we would like to have that for other nationalities as well. But I also appreciate any kind of discussion that you have with your national governments who collect statistics. How do we make people visible? And we, the European Union, issued a guidance note on how to do that, very specific, defining what is supposed to be collected, how to ensure that it's self-identification, because self-identification is one of the thresholds that you need for this kind of data collection, how to prepare the consent forms, what to do with the data, how to aggregate it. It's this, we talked about it before, it's a couple of years old, but it hasn't led to significant improvement on the national level. Since we don't have a legal obligation for member states to do that from the European side, we will still argue in political discussions and in recommendations and try to explain why member states should do that. And to be honest, the last discussion I had about this is 3 weeks ago, and I feel like we had the same discussion for the last 20 years. It always turns around, and then in the end somebody will tell me, but if we ask people that's racist. Well, maybe I ask the expert, and the experts tell me meaning people that are concerned and impacted by racism, that they want this kind of data collected. How are you telling me that it's racist to try to find an idea of how to collect this data?
All right. So I will start, I think, with the opportunities just to counterbalance. But I think that when I was asked to kind of provide some opportunities and concrete solutions, I was thinking that you all know also what is kind of the simplified formula is basically time. You mentioned already, like you need time to get actually solutions going, get maybe from the work that you're doing. You need resources, right? And also the momentum. We all see, I mean, here was the difference when a few years ago Black Lives Matter started, and after George Floyd, we even have a baby from that, which is the European Action Plan Against Racism. And you know how cold it feels right now. No? So the momentum is quite important. And talking from the perspective of equality bodies, they do have some they have competences to actually not only do research and data collection, they also have the competences to, for example, provide policy recommendations. No, so turn the data that they collect into policy recommendations, which hopefully with time it gets into a legislative initiative or a strategy or an action plan. There are examples. For example, in Northern Ireland, the equality body, we were talking about time. So in 2014, no, they engaged with CSOs, with other stakeholders, with researchers, and basically they put up different recommendations on how to reform the Equality Act, no, because there was many gaps, no, in terms of scope, in terms of protection against public bodies, something that we see from our research and from our complaints data. And well, they managed to put this recommendations into a national action plan by the government in 2015. And only there they managed to get a commitment from the government that they will work on reform and actually legislation, which just last year, from 2015, last year, they actually opened the consultation to reform the legal act. But you see on this, that it takes time, but there are concrete examples that actually research and equality data goes into policy action. But also something that perhaps is not so. I mean, it's very important, of course, to have the law, the policy papers, but also litigation. The use of equality data and research for litigation. This last year we actually published a handbook on how to use equality data on legal cases, and this is actually provides not only examples from equality bodies, but also from cases at the European and the national level of how this data is used, and also give recommendations of what steps to do in terms of being how to strategize the litigation to use the equality data, how actually courts could take your data in a more effective way. And this applies not only to equality bodies, it applies to CSOs, to any organization working to promote and fight discrimination. And in this case, we have also, for example, UNIA, here in Belgium, who had a case in 2021 with regard to, it was the labor tribunal, with regard to women with wearing hair curves, who was refused employment. And they, UNIA support the claim with their own data, equality data, and also they identify all their sources of data. And the tribunal actually relied especially on this data to decide the case. And this doesn't happen so often, but at least it happens to identify, for example, that, the actual disadvantage and link it to the protected grounds, or also it helps to, identify the context of discrimination in the country, etc. And we have, like these cases, we have also in the European Court of Human Rights, we have in the Court of Justice of Europe. There are many cases of that, and they are listed and compiled in this presentation. And finally, I think that another solution, another kind of aim of collecting data research, which have been proven quality bodies, is also advocating a tool, for example, for actually collecting data to get better or to improve better the system of data collection. I think what you, Tanja, also mentioned before about the lack of data on race and ethnic, characteristics is, of course, is the first thing that comes out when you look at the system of racial discrimination in Europe. And for me, also, it is shocking working at this topic, because I found this this paradigm in which for example, we have this great, amazing report on being Black in Europe, by the Fundamental Rights Agency of the European Union. And at the same time, the name is Being Black in Europe, which they don't really have the way to, to include, to ask whether you are Black or not. And I've been in that consultation about the report, and I myself, I would not count in that kind of service, no? So it is kind of paradigm where you say, like, how is this still possible? And but also going a bit back to also, or continue with the challenges, is what I was also asking the questions to the previous presentations, no? With the Dutch and the German case are really really great cases, and but I wonder, like, first about the continuity. And in this case, the Dutch case, it is good that it's kind of embraced by the government, but in most cases, all these research and data collections are very ad hoc, and they don't have any continuity. So therefore, we don't have it's not comparable. And therefore also it's like we cannot monitor the progress of the measures, the progress of the incidents, etc. And also at the same time it happens from one organization to another organization, sometimes in a regional part of the country. So we need this role as of a national coordination body, which actually, help to build upon the research that we are kind of having in all around the national level, but also at the European level, because as you say, also in the Dutch case, sometimes at the national level, they don't really follow up with the service, or they don't comply with the recommendation. So it's always very important to have this link with the European level, right? Because they actually can take accountability of the national level. And so for me, just to kind of open a little bit also the conversation to the group, I think I really would like to know strategies to bring this debate also at the national level with institutions. I recently was aware of in Spain that for 3 years the quality body have been negotiating to include a question of self-identification in the life quality survey, the National Life Quality Survey. This is historical in the case of Spain. It has been done already in Ireland. It has been done in other countries, but not in many. But this is the result of 3 years negotiations between the quality bodies, between the affected communities, between the national statistic officers. And the result is just that they will put this question now in 2026. This is great. Okay, this is a great step. But this is only one little light across Europe. So I hope that among you can actually also be part of this kind of cooperation between different institutions, different CSOs, different actors, to bring this topic at the national level with the institutions that have to include the questions of the national statistics. Because yes, we need both. We need the community research, is very important, but we need also the national statistics to include their own budget and their unofficial kind of label, as you say, to this research for everyone, for all of us. So perhaps we can also.
Thank you for both of your answers. Before I also ask you to join us in this conversation, and before I also give up to you, because I saw you made a lot of notes, which I'm curious what you wrote down. I just also want to mention it's interesting. I think it's an interesting perspective to also, both of you played a little bit with like responsibilities of member states, responsibilities of the EU, basically. And I do think it's an interesting point to talk about strengthening or to talking about expecting certain things from national levels with respect to funding and with respect to recognizing these things, because I do think that the national level struggles, for example, with the way that, for example, the Florath study is being used to, and Mila hinted at that today, the way that the study is being used and like basically seen as that one particular study, because it kind of takes away from very, very important studies that have already been done on national level, right? So it's kind of a thing where the expectation to a national level is kind of tied to, okay, how much easier is it for them then though to pull out of that responsibility based on how the EU handles national studies, for example, in comparison to the Florath study, which I think kind of plays into that complexity of like, who is responsible, what should we do, and what are the specific recommendations? So I will hand over to Tanja before I give to the group, but also kind of keep in mind, like, I would like for this to be as specific as possible. Like what are some of the potential steps then in either direction that it could potentially take or that we could potentially need to like improve that way?
So first of all, I would like to emphasize that we work very closely with the colleagues from the FAR, and it's actually the only specific European document that I'm aware of, so I'm using it. That doesn't mean that there aren't a lot of things in the report that could be better or more detailed or with a different method. So, and we discussed this, but even the FAR, who knows how the FAR works, they work with member states. So the FAR doesn't come up with these proxies. They actually rely on the proxies that member states have in order to collect this data. So just to show where the critique should be going on this particular part. Otherwise, we're trying, and I think I can say this with a good conscience for the whole team, we're trying to take as much of the member states' national activities and reports on board. There is a language barrier, because I think we speak about 6 languages in our team, but that's it. And then there are certain reports are just not available, and you don't really want to use the electronic translation for a 300 report on racism in a member state. So that's one of the challenges that you have, but we do try to be as aware as possible. It's also for us, you know, that a question of resources. How many people do you have? How many information do you have? And how much time do you have to process it? When we look at what we can specifically do, so as I said, we work with FAR and we discuss these kind of issues. FAR also gives assistance to member states. So that's part of their mandate, working on a national level with member states. And they're trying as well to get member states to be more progressive in their data collection. We also have ESTAT, which is the European Statistical Office. Please do not ask me what the abbreviation actually means, but this is what they do. And they work with the member states' national statistic offices. And they work on this issue because it's an issue. But again, we work in a political context. So there must be a little bit of political will to actually address it. And as long as you don't have the political will, you can give all the input and all the recommendations that you want, but then the member state will not move. So the idea is also a little bit to build bridges between the European and the local level, so that the ideas and the approach might come from 2 sides at the same time. And the last thing that I want to mention, because it was mentioned a couple of times already, is that the European Action Plan against racism strongly requires member states to develop national action plans against racism as well. To assist them, we developed common guiding principles of how to do that, and a checklist and a reporting tool, which was mentioned today. And in this checklist and reporting tool, which is actually a checklist, so you can check boxes. Have you done certain steps in order to come up with this national action plan? We also have a couple of categories on data. And in these categories, we list national data sources that could be used for the collection of equality. So it's not even that the knowledge is not out there, but it needs to be used.
Thank you so much for that. So, interactive means this is your opportunity to chime in. Yes, please.
I promise I won't say a lot. I'll be leaving shortly. I need to catch a flight at 4. But I wanted to quickly mention on this. You worked for the German government, so maybe you know it. But we have a national action plan against racism in Germany. And they so shamelessly presented it at the Committee for the Elimination of All Forms of Racism last year, November, in Geneva. But in this action plan, what does it talk about? Removing words like race from the German constitution. I keep talking about this because I don't understand if people get how heavy this is. That's one thing. If you compare the EU's National Action Plan against racism and the German National Action Plan, it looks like they're from 2 continents or from 2 different worlds. So this is my problem. How do we create an EU-wide action plan that factors in government perception and how certain governments view certain things? I'll be interested also to hear, for example, maybe about the Netherlands and how the government is thinking, because the intention is, how do we implement this? Because usually the argument part is the longest to agree on something. So maybe this is something you could mention, and how has it been working with different member states?
Let's probably answer because
Sure,
Marius
yes.
has to leave.
Oh, there's someone else. Okay, yeah.
Marius has to leave.
Oh, sorry.
I'm trying to give a diplomatic answer without getting in a conflict of interest here. So, indeed, when the European Anti-Racism Action Plan was adopted, some of the member states already had national action plans in place. And it is up to the member states to decide if they want to renew them or if they fine with what they have. What I'm trying to say is that even the European Anti-Racism Action Plan is a political instrument. It's not a legal framework. So Vanessa introduced the legal frameworks yesterday, the Racial Equality Directives, the framework decision, the minimum standards for equality bodies now. There's a couple of things out there, but there's no legal obligation to have a national action plan or to revise your national action plan on a certain basis. So we give the political recommendation to have one, and we develop the common guiding principles, especially to help member states to tell them what there should be inside there, like not exclusively, but at least as a minimum standard, what should be incorporated. It's a political discussion, and that brings me a little bit back to what Robin said yesterday. He said it shouldn't be the time, it's not the time to talk anymore, it's the time to act. And I'm very divided on that because I would like to agree with him, but I don't think that the time to talk is over. We still have to talk, especially in the political environment that we arrived and that we will work in the next couple of years, talking and convincing people that there is racism and that racism is a bad thing, and it's not only for the people concerned, but for the whole society a bad thing. This is going to be our main challenge in the next couple of years in order to even come to the question how to implement and how to improve the instruments that we have.
Thank you. Is there someone else who would like to say something or ask a question?
No, they go ahead. Then we go with Equinet.
Yeah, very quickly, it's just to widen a little bit this discussion. We were mentioning, somebody mentioned yesterday, the example, the good example of Canada. Do you sometimes compare with what they have done? I used to live in Canada, so I have a good consideration of how they have treated and dealing with this topic. And also to compare with other migrations of the past, how they worked out, even if a lot of things are different, but I'm thinking in the 50s, all the Italians who spread over Europe, how it worked out. And so this kind of comparison in your studies, are you considering them? Thank you.
In South America.
In South
South
America,
America
it's yeah.
Yes, this is a quick answer, and you can answer this question as well. So yes, we do look at what in other parts of the world happens, and Vanessa is actually more competent on the international issues. But we have international networks. We're very aware that, for example, in Brazil, the work on anti-racism is way more progressive than it is in Europe. We also aware that we quote a lot of US and UK studies because we do not have the same kind of studies in the now member states of the European Union, and we need to rely on data collection that is done elsewhere. To the second part, I would like to emphasize, because I find it very important, and it was a very important decision from the European Union, that we distinguish between migration, integration, and racism. We have different action plans on that, and it's not well, it's a related topic, but when we talk about racism, we don't talk about integration. We talk about racism as it regards European populations. And I think this is very important as a baseline for the work that we do.
We also, for example, the example that I gave before with the quality value in Spain, including this self-identification question in the survey, national survey, they did also research on other countries like Brazil, Argentina, Colombia. All these countries have long experience, dealing with the same issues. And that's why I see, I mean, that we kind of all know, like, I mean, there are examples, the knowledge is there. There are handbooks, tons of handbooks and research talking about this need of racial and ethnic characteristics. The UN have so many reports on the need of a member state to collect this data in this way, and also sharing the good practices. So that's why I refer to the importance of the political will and having this conversation, because examples happening here in Europe are also linked to what also you mentioned before, like how can, so I mean, if, for example, in Germany now, see, hopefully that appear in Spain is doing this work, why can they do and why cannot? Of course, there are differences. But if more countries start actually having this conversation and spreading this good practice, hopefully, actually between them, also they start challenging each other. So that's why I think it's of course it's very important to have the experience in other countries. But I think that this is an opportunity to identify the experiences that are happening here in Europe, and and that somehow also maybe it can push other member states to do the same.
Okay, so taking off my moderator hat and putting on my, I'm really interested in this topic hat. So for those of you who don't realize, I live in Belgium, and I've lived in Belgium since 1996. And I struggle with how what goes into the data that's being collected for equality data, and also how availability is communicated. So certainly not just in Belgium, but in other EU member states. So what I'm wondering, because I sat representing health status and to a very lesser extent on race discrimination on the UNIA equality data report, which was just published about 10 days ago in French and Dutch and comes out in English at the end of summer. And one of the things that I really noticed going through that whole working group discussion was that certainly for health status, there were differing opinions by the stakeholders. So it was great to have multi-stakeholders and really people with lived experience on it. But the difference in actual knowledge of what we were talking about actually skewed the result. So, and I'm guessing that it was probably fairly similar when in the groups who were really focusing on race discrimination as well, certainly in the Belgian context. So I guess it's a question of how do we, and this is an open question, but how do we, A, make sure that those that need to actually be putting together the frameworks, because what you get out is as good as you put in to these frameworks, how do we make sure that people, A, are aware that we do have all of this excellent checklist and whatnot from EU level? First I'm hearing of it. You know, I'm really happy that I'm hearing about it, but it is the first. I've just spent a whole year on this, on other things. So how do we bridge that gap of communication and not do the usual EU thing of, yeah, we have a nice website and then move on? And also, how do we make sure that the people of lived experience, myself included for health status and race, that we're actually prepared to really contribute to the discussion so that we're not actually arguing amongst ourselves, because that does happen. So I guess that, and I see lots of, so over to everybody else.
Thank you for that question. There's another one, and I feel like we might collect a little bit.
I want to react on what you just asked. I think I said it yesterday, so I'm just going to say it again. I advocate that in Europe, we really set down a legal framework in which different ministries of the different countries work together. And I think in the legal, we need the ministries of justice be part of this, together with internal affairs or wherever you have discrimination and racism housed. If you look to other sectors, for instance, as I said yesterday, human trafficking, in Europe we succeeded in human trafficking to have an advocacy for all the different countries to have a national rapporteur who has more power or whatever you call it than a national coordinator, who can act actually more than the watchdog for your national government, who can make them do stuff. So if we can get that done within Europe and make it important that they collaborate with each other and have the same kinds of standards, the same kinds of things that needs to be done, they control, they oversee what each other's work and control that, but also their governments. And that way you can get more of a unified way of working within the EU. But I think about that, the governments need to find it important that racism and discrimination needs to be battled. That's the issue.
Thank you. Then we have one more person in the back. Yes.
Thank you. Liz Kelly, maternity advocate from Ireland. And I'm hearing and learning a lot here. I'm not a statistician, but we realize.
Don't forget that the whispering is being heard online. Can you please restart, because it was quite hard to understand in the front.
Okay. Sorry, Liz Kelly from Maternity Support and Advocacy in Ireland. I'm learning a lot here. As I say, I'm not a statistician, but we in our maternity advocacy really realise and rely on the importance of statistics and information as unbiased and as comprehensive as possible. But the perspective I'm learning here a lot about is that in Ireland we have very strong, we have an Equal Status Act which came in 2004. and it covers 9, now 10, it's been amended a few times, grounds of discrimination. It's a really strong piece of legislation that race is one of the grounds for discrimination. And it is used constantly. It works against, there is a commissioner, an equality commissioner and human rights commission in Ireland. So if people experience discrimination, whether it's perceived or whether it's real, they are entitled to go to the commissioner, and it is taken, a case will be taken, and it is taken very seriously, it's acted on, and sanctions are applied immediately. It works across workplace and it works across, social and civic. The part of this that it doesn't catch, the racism that it doesn't catch is the racism that we don't hear about, that can't be captured or quantified. The remarks, the myths, the medical myths that people, the pain relief, it doesn't capture this. But I think without some kind of a legislative framework, it's going around in circles to try and implement guidelines and policies for data collection, because it then depends on the goodwill of the provider or the institution, and without sort of legally binding guidelines in place, it's going to be always ad hoc and that. And I think maybe it needs to go back to the first step of somehow putting in robust anti-racism and equality. We don't necessarily call it anti-racism, just act, it's equality legislation, so that it covers disability, it covers racism, it covers a wide range. The other, if I make a brief point, was the presentation from the Netherlands this morning. We can't capture this soft maybe data. It's not soft because the impact is far-reaching on people when they're verbally abused, and this is increasing. It's increasing all over Europe. We're seeing an increase in Ireland where it would not have been really such a big problem. It's a problem everywhere. Is it a possibility to create some kind of simplified app where people can log in and just document? One of the aspects of our advocacy work is we always insist on people to document their experience. We don't know what it's going to be used for or where, but we have a collection of documented. We can watch trends and see patterns and then see where we need to go. Is it possible to develop some kind of an app across Europe? I don't know if that's right or wrong, or if that'd be acceptable or not. Not to collect individual data, to collect themes, types of discrimination, types of abuse, but that could be correlated and could be said, because verbal abuse is the start. When verbal abuse becomes accepted, physical abuse follows, segregation follows, and all these things. And they're just my 2 points for, I hope it's helpful from a different perspective.
Thank you.
Thank you.
We have 2 more, and then I think we're running out of time. I would like to hear you as well.
Well, I'm working with the microphone. Self-reporting
Yeah.
is done with the National Victims Commission in Mexico for victims. Self-reporting, it's publicly available.
So maybe more practical comment, because we are talking about models from the States or the Canada, because I completely agree with you, Tanja, because Nancy Krieger is a very prominent Black scholar in the field, and she says if we don't collect data on race, we are cutting in the area of systemic injustice. But how and who is doing the data, depending on how and who, we can also cut in the area of, so how to collect data and achieve equity, not equality, equity. So, and this was a huge discussion. I'm a member of the International Collaboration of Participatory Health Research to establish CBPR as an approach in public health, which meanwhile is the National Institute of Health in the States has a particular fund of funding community-based projects, because we have the evidence that the impact on the long term, when it comes also to knowledge translation, is very strong. And CBPR, not community-driven, CBPR means bringing three perspectives together: policymaker, science and community. Meaning, and the goal is how to translate the knowledge into action in order to achieve social change. It's pretty much informed from the colonial theory, and they have the so-called community campus partnerships for health in the States. We have annual conferences, we have international network,
And we have, last week, I saw that the Lancet published a very nice publication on normalizing participatory health research approaches in the European region. So this is the trend, this is the future. But I still would say some topics should be kept for community-owned research. The University of New Mexico has established another ethical principles by saying if we do research with indigenous communities, the rights for the data stays with the community. If I, as a researcher, want to use the data for publication, I have to go through an ethical committee board completely from indigenous people. We have to think about data justice and data governance. Is very important when it comes to race, not only to race, also other stigmatized topics. So thank you.
Thank you. And then the last one was. Oh, okay.
We're good.
We're good. I'm hearing we're good. Okay. Thank you for thank you for your contributions. I would like to hand it over to you. Maybe also see this as an opportunity to respond, but also kind of like give us a closing idea. And if you can pull in some strategic outlooks and or also needs to continue these efforts from the perspective that you're talking out of, which would be great to just like wrap it up a little bit and keep the time in mind a little bit once you two finalize, because we have heard a lot. So yes, I'm going to give the stage to whoever wants to speak first.
I'm going to give them the last one. So looking at my notes, we started with different levels of knowledge and lacking knowledge in the communities about what is already out there. That's a question that I would like to give back, because that's a question that we have as well. I know, and Daris mentioned it, we have dozens of handbooks, and we have dozens of initiatives, and we, as from a policymaking perspective, we tend to go to new things instead of reiterating what we already did. So it would be very appreciated to let us know how to reach the relevant stakeholders, how to reach the people that need this information, how to reach the communities with the things that we're doing. I will still refuse to go on Twitter, but for any other option, I'm available. And this is where I forgot to comment on the first study. So as I said, baseline, I work with the first study a lot, but I have this wonderful sentence: almost half of people of African descent surveyed experienced racial discrimination and increased from 39% to 45%. Okay, that's horrible, but based on my personal experience, I don't think that it's just 45%. I'm very thankful for the Afro census, who gives me a number of 98%, which I personally think is more realistic than 45%. But that also means it's knowledge about what is actually racial discrimination. What do people understand when they talk about it? And we have the legal version with the anti-discrimination laws that are in place in all the member states, but we also have different understandings of what does it mean and what falls into those categories in the different member states. So there is that's for me a conversation that we have to have constantly, because these terms also develop over time. And this was mentioned, and we discussed this yesterday. What does it mean? What terms to use? What terms to not use? How do we measure that? And this is one of the arguments that the statisticians always come in with, that they said that the statistics are useless if we change the terms on a constant basis, because then we can't compare to the last survey that we had. So there's a lot of issues that need to be addressed. And this is where making the circle, taking up the idea of the policymaker communities and academics, which sounds wonderful. We hope that we can do this. We tried it in Germany a little bit. You know about the marginal successes that we had with this particular project. But let me assure the good intention is there. So we keep on trying.
Yes, I think first answering the question about the hard challenge not to grasp, I think it was like a bit more structural, invisible discrimination. I think that's a question that perhaps we need to pose this more often, no? To include this also not only legislations but also policies in the research, data collection. Also in relation to the app, actually, I mean, Ireland is a great example of collecting data. You have also, I didn't mention before, but no, you are also even now they have an ongoing work on adopting a strategy on equality data, which is, I think, unique in the European Union. So that's a good step, forward again. Another opportunity to share this with other member states. And also you have for example, there's an app to monitor and track hate, which is also by the Irish Human Rights and Equality Commission. That works pretty well. They have a report like 2 years or 3 years ago. I can share. But my takeaways is basically I think what I really see the value of this conversation is also the value of this cooperation, this exchange of information, of good practices, cases, and I think one example also is the work that Disco Network is started. I really appreciated how it has developed, with time, how we included voices from health experts, but also from EU policy, from national, from the specific to the general, and that approach is really important to start the ball rolling. And now we have also, in addition, like a year ago, United Nations also, here Mila also contribute, add up to to this role. I think that the Commission also picked the topic and did this workshop on health. And hopefully, just linking now with the next session, the next action plan, because I take it for granted. No pressure. I guess very soon. I guess very soon will include some of the, a big perspective on health and perhaps take stock of what has been said here. So thank you.
Thank you so much for wrapping this up, and also thank you for your contributions. We are about to head into the next session. I thank you for participating. Also, I think because not so much is seen as a critical conversation, more so as a conversation that opens for reflection and that expands on the things that are already happening, right? So I just hope that the session also gives you the feeling of that collaboration is one of the most important factors when it comes to allyship and also collective progress, okay? And I think that's something that we can take away from today's session. So thank you guys again, and also you. And yeah, thank you. Bye.
Thank you so much. Okay, into the last session of the day, we're going to give you a short bio break in order to go pick up some coffee, bring it back in, so that you can we can do the wrap up session of where do we want to focus, and that will be moderated by Fraser. Wait. Thank you. That will be moderated by Fraser Goodwin from EFA. So if possible, I can give you until 30, so 3:30. Oh, that's 17 minutes. Wow. To go get a bio break, bring your coffee, water, juice, and then we have our strong finish and our family photo of those last still standing. Thank you.